Antonini, and for my special populations project, I chose stress and anxiety disorders. What is stress and anxiety? Stress and anxiety work together hand in hand. Anxiety is a normal emotion. It's your brain's way of reacting to stress and altering you of potential danger ahead. Stress and anxiety are not always bad. In the short term, they can help you overcome a challenge or dangerous situation. However, if stress and anxiety begin interfering with your daily life, it may indicate a more serious issue. If you're avoiding situations due to irrational fears, constantly worrying, or experiencing severe anxiety about a traumatic event weeks after it happened, it may be time to seek help. People tend to feel anxious now and then. For example, you may worry when faced with a problem at work, before taking a test, or before you make an important decision. Occasionally, anxiety is okay, but anxiety disorders are different. Stress and anxiety disorders. Stress and anxiety disorders are a group of mental illnesses that cause constant and overwhelming anxiety and fear. The excessive anxiety can make you avoid work, school, family get-togethers, and other situations that may trigger or worsen your symptoms. These are different types of stress and anxiety disorders. Generalized anxiety disorder. This is when you feel excessive, unrealistic worry and tension with little or no reason at all. Panic disorder. You feel a sudden, intense fear that brings on a panic attack. During a panic attack, you may break out in a sweat, have chest pain, and have a pounding heartbeat. Sometimes you may feel like you're choking or even having a heart attack. Social anxiety disorder, also called social phobia. This is when you feel overwhelming worry and self-conscientious about everyday social situations. You obsessively worry about others judging you or becoming embarrassed or ridiculed. Specific phobia. You feel intense fear of a specific object or situation, such as heights or flying. The fear goes beyond what's appropriate and may cause you to avoid ordinary situations. Separation anxiety. Little kids aren't the only ones who feel scared or anxious when a loved one leaves. Anyone can get separation anxiety disorder. If you do, you feel very anxious or feel fearful when a person you're close to leaves your sight. You always worry that something bad may happen to your loved ones. Selective mutism. This is a type of social anxiety in which young kids who talk normally with their families don't speak in public. This could be at school, playing at the park, or just being around friends. Medication-induced anxiety disorder. Use of certain medications or illegal drugs, or withdrawal from certain drugs, can trigger some symptoms of anxiety disorders. Here are some symptoms that cause anxiety or stress. Excessive fear or worry, trouble breathing, sleeping, or sitting still, feeling of panic, doom, or danger, cold, sweaty, numb, or tingling hands or feet. Your muscles tend to tense up. You can become very nauseous or suffer from dizziness. Or you can think about a problem over and over again and are unable to stop. Prevalence with stress and anxiety. A total of 442 students participated in a study with the mean age of about 20, 1.59 years above and below. Overall, the prevalence of stress, anxiety, and depression with various degrees was 62.4%, 64.3%, and 60.8% among students sampled respectively. Higher stress and anxiety scores were significantly associated with the female sex, older age, and BMIs greater or equal to 25. Higher depression score was associated with increasing age, low socioeconomical standard, and among students from different governors. If you look at this chart, you can see that nothing below 55% has come people with stress, anxiety, and depression. You can also see that the male student is always lower than the female student. Effect stress and anxiety has on exercise. Stress and anxiety can affect how your body feels, moves, and functions. Exercise can help get rid of the stress and anxiety. Any form of exercise works, from aerobics to yoga. It can act as a stress reliever. If you're not an athlete, or even if you're out of shape, you could still make a little exercise go a long way towards stress management. Exercise can also pump up your endorphins, reduce the negative effects of stress, be very meditational with motion, and overall help improve mood, which can help you throughout the day. Medications prescribed for stress and anxiety. Benzodiazepines are sedatives that can help relax your muscles and calm your mind. They work by increasing the effects of certain neurotransmitters, which are chemicals that relay messages between your brain cells. These help treat many kinds of anxiety disorders. More examples of these drugs are considered Xanax, Librium, and Valium. Buspirone is used to treat both short-term anxiety and chronic long-lasting anxiety disorders. It's not fully understood how buspirone works, but it's thought to affect chemicals in the brain that regulate mood. Buspirone can take up to several weeks to become fully effective. It's available as a generic drug as well as the brand name drug Buspar. Antidepressant medications work by affecting neurotransmitters. These drugs can be used to treat anxiety symptoms, but they usually take 4 to 6 weeks to produce noticeable effect. With all drugs and medications, there are multiple side effects which can be worse than others. A big problem with these type of medications is that they are highly addictive and often end up with the patient not being able to stop trying to take them. This is my case study. A 28-year-old Caucasian female presents to the clinic with complications of joint pain and intermediate lower back pain. Patient cannot recall any mechanics of injury. She reports she has trouble falling asleep at night and is unable to get a good night's rest. She often feels restless or on edge, which she associates with not sleeping. She states she constantly worries about her performance in school, her family, her mother's health, who has recently been diagnosed with stage 4 small cell carcinoma. Patients also state when she wakes up at night with throbbing headaches that last for a couple of hours. She feels tense the majority of the day, causing her to feel stiff. She also has difficulty paying attention in class and finishing her homework. This is a chart of her exercise prescription. After reading her case study and seeing how stressed out she was during the week, I thought it was most appropriate to work out 5 days of the week, resting 2, and isolating each muscle group. As for Mondays, she will do chest. The exercise will range from bench press, pec flies, tricep extension, and push-ups. Tuesdays, she will do legs, which consists of leg press, leg extension, bodyweight squats, and calf raises. On Wednesday will be her first day of rest. On Thursday, she will do back, which will consist of lat pull down, bicep curls, T-bar row, and dumbbell row. On Friday, she will do shoulders, and she will do the Arnold press, the face pull, dumbbell flies, and shrugs. On Saturday and her last day of exercise, she will do legs again, consisting of the leg press, leg extension, bodyweight squats, and calf raises. And on Sunday, she will rest. Now, I know this seems like a lot, but with the amount of sets and reps she's doing, with the rest in between the sets, and lowering the weight, I think this is the perfect amount to relieve stress while also gaining gains. Some modifications for people who have stress and anxiety for the gym would be making sure the exercises are easy and simple. If you bring your client into the gym who is already stressing out enough about going to the gym and trying to complete a complex exercise, it's never going to work. They're just going to have a hard time, and it's going to stress them out even more. Avoid overworking. If there's too much on their plate and the reps and repetitions and weight is too high, they're just going to overwork themselves, which is going to lead to more stress and lead to more anxiety. Cardio is a great way to relieve stress because you can think. Walking is a huge help for this because you can settle down your mind and get your mind off certain subjects. Yes, many people like to listen to high-tempo music to keep them going throughout their workout. For someone who has a lot of stress and anxiety, I would avoid the loud up-tempo music and switch to something more calming to help ease them throughout their workout. Another fun way to help this out would be working out with a partner. Going to a new gym by yourself is stressful enough as it is. So if you have a partner, it will calm you down and help you get throughout your workout. In conclusion, nowadays it seems more and more people end up having stress and anxiety disorders. This has become more common in people younger in age. No one knows why this is, but technology and social media tends to be a main reason. This prescription of medication for these diseases can be very harmful and send people down the wrong path. Exercise can be the best kind of medicine for this type of disorder because not only can it relieve stress and anxiety, it can also build up a great amount of self-confidence, which will just help out everyone in the end. These are my references.